Did you know there was a hidden hunger crisis among seniors? Well, there's a new campaign that connects older adults to nutrition aid. Today, I've got Sandy Markwood, CEO of USA Aging. Good morning, Sandy. How are you?
Good morning. Thanks for having me.
Well, thank you for joining us. Why are good nutrition and healthy eating so important to older adults?
Well, good nutrition is important for all of us, but for older adults who may have additional health conditions, nutrition is really, really critical, not only to their physical health, but also their cognitive health. When you look at good nutrition, it plays a major role in combating chronic illness, also in boosting a person's immune system, and it plays a major role in enhancing brain health. In addition to those physical conditions, food also plays a major role in bringing people together, which is also a critical solution to the issues of social isolation and loneliness that many older adults suffer from.
Now, what challenges do older adults face to eating well?
Well, there are many challenges. The big one is the cost of food. Recognizing that so many older adults are on fixed incomes, the cost of food is a major affordability challenge. But also for older adults who may give up driving or restrict their driving, don't have any other transportation options, just getting to the grocery store can be a major barrier or challenge. And then also the older adults' health themselves pose major challenges. For instance, older adults who have mobility issues or older adults who are suffering from some cognitive restrictions, they have issues that may impede their ability to go food shopping or to cook. Also, certain medical conditions may impact a person's diet or also just their general appetite. And then again, going back to that issue of social isolation and loneliness, that also impacts an older adult's eating habits. And recognizing how many older adults in this country are living alone, that is a major concern as well.
Now, what kinds of community-based meal programs are there for older adults?
There are multiple programs, but I wanted to highlight two in particular. The congregate meal program is provided by nationally by area agencies on aging. And they provide this program. It's a meal program that's provided in places where older adults are already gathering, like a senior center, a church. Also, some area agencies also partner with local restaurants. But at those sites, you can get that important nutritious meal, but you also get the opportunity to socialize. So it's really blending that opportunity that good food is good for the body and good for the soul. Additionally, on top of congregate meal sites, for those older adults who may be homebound or unable to leave their home to get to a congregate meal site, there are home delivered meals. And home delivered meals are meals, they're either fresh or ready to heat meals from menus prepared by dietitians that are delivered directly to an older adult's door by vetted area agency on aging staff, meal providers, or community volunteers who are delivering a nutritious meal, but they also are delivering connection to that older adults. They may, in fact, be the only other person that older adult sees in any given day.
Now, how do home delivered meals work and who qualifies?
When you're looking at home delivered meals, one of the restrictions is that you are homebound, that you cannot get out of your house to get to a congregate meal site. But congregate meals and home delivered meals are typically funded through the Federal Older Americans Act. So the only really restriction on that is that you be over the age of 60 to be able to get those meals. Of course, funding may be an issue. These meals are funded again by the Federal Older Americans Act, but also supplemented by state and local funding and also local donations. But for the participants, there is no charge. They encourage donations, but there is no requirement for a donation.
So, what do these programs cost?
Well, locally for the area agency on aging, it varies depending on the market they're in, and the provider contracts that they have. But they range generally in the cost from $5 to $10. But if you're doing a medically tailored meal, it may cost more. But again, for the participants, there is not a charge. There's an encouraged donation, but not a specific charge, recognizing that many of the older adults that are participating either in congregate or home delivered meals are again living on limited incomes.
What is Elder Care Locator and how does it help people find local meal programs?
Well, the Elder Care Locator is a national information and referral service that is funded by the U.S. Administration for Community Living, operated by U.S. Aging. But it really is a referral source to help older adults or caregivers find their local area agency on aging or other aging community-based organization that are providing these needed nutrition services we just talked about, but also medical transportation or in-home care, caregiver support. They offer and can give you access to a whole range of aging services in your community. To access the Elder Care Locator, you can just call 800-677-1116. Again, 800-677-1116. And you'll talk to a trained specialist at the Elder Care Locator who can give you that critical information. You can also go online to the Elder Care Locator at www.eldercare.acl.gov. Or if it's easier, just go directly to the US Aging website at usaging.org.
Now, do they have any other neutral or nutrition services?
Actually, area agencies do provide a broad array of nutrition services, and those include nutrition counseling and education, also helping people connect to the Supplemental Nutrition Assistance Program or SNAP. They also provide groceries or during season fresh produce boxes for older adults, as well as conducting cooking classes and also providing caregiver nutrition training in the community as well.
I've been speaking with Sandy Markwood, CEO of US Aging. Thank you so much for joining us today. Thank you.
Thank you so much for having me.